Today we are so pleased to have with us Dr. Leandri Linde from Atlantic Eye Centre in Cape Town. She's an ophthalmologist, and we're going to hand over to you now just to give yourself a bit of an introduction and tell us what led you to become such an expert in your field and what keeps you going in this domain.
Thank you. It's lovely being here, and yeah, it is definitely a long road. So I'm an ophthalmologist, and often people ask, what on earth is that? It's basically a medical doctor that then further specializes to do specifically eye surgery, but not all cases related to eye pathology is necessarily surgery. Sometimes there are smaller procedures, or even eye drops that can cure certain disease or just certain changes in lifestyle, etc. And then I further my studies did a fellowship in oculoplastic surgery, which is then again the plastic and reconstructive surgery around the eye. So if you think of hooded eyelids or bags under the eyes, those type of things, or teary eyes where we need to open the tract into the nose again, or your cancers on the skin around the eye. Sometimes that needs to be cut out and then reconstructed. And then another interest that goes or closely associates with that is actually the cornea or the ocular surface. And if you think of the lids and the ocular surface being so closely adjacent, pathology in one area greatly impacts pathology in the other area. So that's just a little bit more my expertise, yes.
Amazing. So what are your thoughts on eye health and overall wellness? What is the link between the two, although it may seem obvious? And how can we maybe look at the importance of like healthy functioning eyes?
Yeah, so eye health is obviously having a major impact. I mean, it's the most feared disease or most feared disabilities, actually losing your sight. And as everyone can imagine, your economic status is influenced, your ability to take care of yourself, your dependency on others becomes a major factor. So it's all encompassing. Socially, it can be impact in many ways, psychologically. But then it's also about perspective, and we have such amazing institutions. If you look at the Helen Keller Society and what they are doing with their low vision aids and how they train people with low vision or no vision, how to better take care of themselves, small tips and tricks that you can use to be as functional as possible. A lot of job opportunities you can still do with the one eye, for instance, and it's not like you're losing your driving ability if you've lost one eye. So there are amazing tools and available that can assist you to have as normal a lifestyle as possible. But then also role models like Hein Wagner, for instance. I mean, he was born blind, and he has literally become an ultra marathon athlete. I think he's got the land speed record for going faster than 300 Ks with his blindness. He's a motivational speaker.
Incredible.
And you can learn from people like that you can have sight and not vision, but you can also have no sight and have vision. So it's what we do with what we have and how we use maybe obstacles to create opportunities. So that's always encouraging, looking at stories like that.
Incredible. So let's chat about all the recent advances in eye care. There's been a lot this year. What's the latest research and tech and cures that have come out recently?
I think one of the most practical things is probably if you look at a condition that is called age-related macular degeneration, which is still something that we don't have a cure for, and it affects Europeans and more than any other ethnicity. So you used to have you get dry and a wet type. So in the wet type, for instance, you need monthly injections. Very taxing on a patient, having to come for a doctor's visit every month, having a procedure done, time off work, if there's maybe a complication, the recovery thereof, and just the impact that it has on you. So there are a lot of advances in that direction where we are having better drugs, better drug delivery systems, and you can go 3-4 months quite successfully without needing monthly injections as intensely as before. Obviously, it's more expensive still, and certain people won't qualify for it, but that's quite exciting. And then there are so many areas. I think ophthalmology is one of those faculties that we use technology all the time. So when you go to the eye doctor, you get so many tests done, and people often ask, why all these tests? But it's literally the early detection of disease that has advanced so great, and how we use technology and even artificial intelligence within that technology for the monitoring, the early detection, the screening. And that's why it's so important. So there will always be continuous advancements in those areas. And it also helps a bit with the screening, where you can maybe reach remote areas easier than we could before, because it is most of the disease that we pick up is quite an intensive investigative procedures. With maybe our new technology and apps and things, we can reach more people and maybe have better screening programs potentially. There's still limitations in that in terms of training staff and actually looking at all the data with still an expert eye, and maybe the cost involved, etc. But that's exciting.
Yes.
I think there's a lot in gene therapy being done as well. So if you think of your inherited retinal disorders and so forth, there's massive studies being done in that regard. It's still quite unaffordable for the general person, but if you're willing to be involved in the major studies, then that's a way to access it at least. And often early on treatment, so maybe your inborn things rather than later things. Robotics are being introduced into the surgical field, and the first cataract surgery has been performed that way, which is probably a little bit longer still than the human can do it, but it's also advancement in terms of remote locations, for instance, and the surgeon not actually having to scrub up.
Yes.
Things like blood disorders, everything from anemia or leukemia and those type of things. Certain cancers can metastasize to the eye, that you can see a small recurrence maybe earlier than you could elsewhere. Degeneration or your nerve problems, that can be picked up in the eye. So in terms of screening and overall health, it really is a crucial instrument to use.
Absolutely. Let's unpack how the eyes affect the nervous system. How important, well, you've just mentioned it briefly, how important are the eyes connected to everything else?
I always tell patients, you actually see with your brain. So we think it's the eye organ, but it's so amazing how it's designed or created, that the eye itself is actually literally part of the brain. So you have your retina, which is basically nerve fibers, and that connects to the optic nerve, which is also not a peripheral nerve, it's a central nerve. So it's a direct connection to the brain. And that just tells you that that's exactly what's happening. It's these receptors that are interpreting light and literally transforming it into an electric signal that then goes to the brain. And that is how we see. And that interpretation of the actual signal coming in then becomes crucial. So how the brain is able to interpret it. And things like strokes, for instance, the eye is perfectly functional, but the interpretation of the message can be affected. And then it's even more vast than that. So not just the reception of light, which is crucial, but also depth perception comes from your vision, spatial awareness, your color discrimination. You also have your autonomic system, which is your sympathetic, which is your fight and flight. If you think of your pupil size, for instance, sometimes we will look at the pupil size and we can pick up a sympathetic disease like a Horner syndrome, for instance. So someone sitting with a small lung cancer might present with a dilated pupil, and we can detect that cancer so much earlier than in any other way. Or your parasympathetic system, which is kind of your rest and digest, and that also has an influence on the movements of the eye or pupil size. Your circadian rhythm is the other thing that's affected. So blue light that stimulates your melatonin and affects your wake-sleep cycle and your overall hormone release and things like that, which also becomes quite a crucial thing. And then if you think of development, eye-hand coordination, for instance, so that's part of growing up and developing. And if a child doesn't have good vision, then their ball skills or their coordination, their balance, all of those things might be affected adversely, where it could have been prevented or detected earlier. So if you also think of children, we don't often check their eyes individually. And you might miss one eye not seeing as well as the other eye, or not seeing at all. And that means that that part of the brain never gets the stimulation that it needed to develop the brain in order to interpret the image. So now you have a perfectly normal eye, which maybe just might have needed a little bit of a refractive assistance, like a spectacle, for instance, and the brain would have developed normally. But if it missed that opportunity, which only happens in the early years of life, then you end up with something like amblyopia, which just means the interpretation of the message isn't there, even with a normal eye.
Perfect. Growing up, we were always told to eat carrots for good vision. How is nutrition linked, if at all, and what does good hygiene and practice look like?
That is important. So diet affects most part of our bodies and the normal functioning thereof, as we all know.
Yes.
So the photoreceptor regeneration, which is basically these little nerve cells that we've spoken of now, for them, in order to kind of repopulate, regenerate, they do use vitamin A. So that's where the yellow vegetables, like the carrots, for instance, comes into play. It is part of that cycle and the need for new cells to be formed. And then most of our studies are actually on AMD, which is the A-RED studies. So that's very good scientific information for why we need certain vitamins and supplements. So we often only recommend it in people with advanced disease. If you think of someone with moderate to severe AMD, they definitely need to go onto these specific type of supplements to try and not regress, but to try and protect the fellow eye from not having as advanced disease. But from that, we also learn what is needed for the normal functioning eye. So if we think of green leafy vegetables, that becomes important in our eye health, and that can be both for the back of the eye, the macula, those receptors that we are speaking about, but also if you think of your ocular surface or the cornea, that often needs things like vitamin C to have a healthy surface. You have people having an extreme dry eye called xerophthalmia in remote areas where they don't have access to fresh fruits and vegetables. So vitamin C is going to be an antioxidant that protects it against quite a few things. Vitamin E is something else that supports that or works synergistically with that vitamin C, which becomes important. Those are things like avos, nuts, and seeds. Zinc is another component that becomes crucial in that melanin or pigment production. That's a protective barrier for the eye, almost like a natural sunscreen in that macular area. And then you can think of things like liver, red meat, poultry, oysters, seeds can often have quite healthy things. And then I think that's going to be your main thing. So that healthy, balanced diet, they often speak about the Mediterranean diet as having the strongest evidence for eye health. And so that's going to be your healthy fish oils, your omega-3 and 6s, your fresh fruits and vegetables, good hydration. With that, you can also limit things like smoking and alcohol. That also obviously attributes to the way that blood or nutrients are supplied to the eyes. Usually the cases where we see macular degeneration are the people with a poor lifestyle. Also diabetes, if you think of high sugars, refined carbohydrates, that's also the things that affect the blood supply health to the eye. So leaky vessels and nutrients not being able to being supplied to crucial structures can have an impact. Sun exposure is another big one, especially in South Africa. Everything from the front of the eye to the back. You can have UV damage to the front, which can cause something like a pterygium or a pinguiculum, or little eye cancers on the skin and on the eye itself, as well as back of the eye problems in that regard. So good UV protection and hydration always comes into play with that.
Okay, perfect. We recently found a 2020 statistic that an estimated 11 million people in South Africa have vision loss, with 370,000 being legally blind. And it seems like older age and females or someone having prior diabetes diagnosis are most associated with higher risk of vision loss. Why do you think women are more at risk here? And do you think it's maybe hormone related?
So as we know, old age and diabetes is massive on the blood health or the supply of nutrients like I've just mentioned. And then estrogen, we also know, is a neuroprotective component. So you'll also have risk factors increasing in terms of cardiovascular disease with lower estrogen. So that link becomes important then if you think of how dependent the eye, both the nerve and the retina, is on good blood health or blood vessel health, in other words. So it makes sense that the risk is higher. The other two things they usually mention in females also is dry eye disease. So as our estrogen and progesterone levels drop, oftentimes dry eye disease is aggravated. And then more importantly, maybe AMD and glaucoma also has a slightly higher risk, and that's again that neuroprotective effect that estrogen then provides.
Perfect. Let's discuss the link between genes and vision.
So yeah, definitely a strong link. Also more common in certain disease than in others. So your serious things are going to be the genetically inherited disease. If you think of something like retinitis pigmentosa, for instance, which is a very strong autosomal dominant or recessive trait, you get different types of inheritance patterns, and that becomes then an inborn defect. But also your genetics in terms of being at a higher risk, and your epigenetics, so the environmental factors that go with the genes, so how we live and how that affects the genetics that we are born with. So everything from eye cancers, AMD and glaucoma, like we've mentioned, even cataracts can be genetically acquired, especially if it's in youth or in infants. Even get younger onset disease, which is more going to be related to your genetically inheritance rather than having them at the older age, which is then the more lifestyle related types of things. Oftentimes we speak about keratoconus as well, which can be genetically associated, but it also can't be. So some of these things we have hard evidence, and some we can't explain why some do get it in the family and some don't. So across the board,
yes.
And that's also why the gene therapy make a big difference in that regard.
Perfect. And then I know we've just briefly touched on it, but what is the link between hormones and vision, especially sort of when your hormones fluctuate? So for instance, teenagers, pregnancy, how does that all work?
Yeah, that's actually a great question, and I think you can look at all the different groups. You have your menopausal women, even pre and post your pregnancy, and your teenagers having a lot of effect in that regard. So let's maybe start with our females, just because we've touched on it already. So in terms of maybe menopause or even pre-menopause, when you are on something like contraceptives, and then post-menopausal has a whole different profile again, and then your pregnancy. So low estrogen and low progesterone levels are often going to be the times that you have a very dry or gritty eye. So the dry eye disease, the evaporation of the tear film, the quality of the meibomian glands, which is coming from the androgen side again, that can be affected. So things like contact lens intolerance or blurry vision, especially with using screens as we do in our lifestyle often today, that can definitely add to that. Then in your higher levels, maybe in a pregnant woman, oftentimes you have refractive fluctuations. So the cornea itself can actually become a little bit swollen or boggy, which can affect the vision, or certain lens changes can happen, so that temporary refractive changes. There are also some thought on IOP or intraocular pressure being affected. Oftentimes in teens it's quite negligible, but in pregnancy it can be actually beneficial because there's a lot of the eye drops that we wouldn't want to have you on during your pregnancy. So it might even be safer to stop things and hoping that the fluctuations get you through that stage. But always, if you are on any eye drops, don't think it is not absorbed systemically. So if you do fall pregnant, make sure that you are on the right things you need to be on. Don't just carry on the way. There are more serious things that can unfortunately happen with pregnancy as well, and that's mostly related to the vascular influx and how much blood flow and things. I don't think we'll go into all of that, but if you notice not just the occasional blurry vision, maybe it's more severe or drastic vision loss, always have that checked, and that can be both on the nerve side of things or on the vascular side of things, or even related to the brain. Any pressure on the brain can manifest in the eyes. So always be cautious in that line. And then if we look at teenagers, they often have high levels of growth hormones, so your insulin growth factor and all of those things. So your eyeball as well grows, and you can imagine this spurt or this intense growth happening in the eyeball. We call it myopia, which is just the enlargement of the eye, which can be a normal process or a pathological process. So genetics again come into play, or your environmental things. So intense near work for long periods of time. We often recommend you are actually supposed to look in the distance a good hour or two a day growing up, so that you have that distance vision and just balancing that effect. There are amazing tools available. You can, at your local optometrist, ask about things like DIMS or certain defocus type of spectacles that can also slow the rate. Sometimes we can add drops like atropine drops that can also slow down the progression of the pathological myopia. But that's that enlargement of the eye happening. They often also struggle a little bit with dry eyes or irritated eye, contact lens intolerance, as those sex hormones can be up or down, for instance, again affecting the glands that produce the oily layer of the eye and things like that. They can be more susceptible to a blepharitis, so sometimes an overpopulation of a little Demodex mite often happens in the young or in the old, and that can add to maybe irritated eyes, grittiness, red eyes, things that maybe make you a little bit contact lens intolerant again, or the acne treatment that they are often on.
Yes.
Anti-androgen drugs, or your Roaccutane, for instance.
Roaccutane.
Yes, the dryness. Yeah. So that ocular surface health can be a little bit compromised, and you can with an eye exam see exactly what is maybe attributing to it, and have some supplements like natural tears or certain lid cleansing regimes that can aid a lot in that. We usually screen, if you notice a teenager that has progressive astigmatism, for instance, that is out of keeping of their normal rate. So usually children will have their glasses changed more frequently than adults, let's say every year, or sometimes even every 6 months, depending. So if you are in a category that's progressing even faster than that, especially in terms of astigmatism, We always screen and see, are they rubbing? Is it an allergic patient? Is there a keratoconus family? Because those are also the teenagers that we can significantly affect later vision loss by treating that early, because it's the rugby ball shape of the eye that progresses too quickly, and you end up with this outpouching of the cornea, which is difficult to address later in life. But with early intervention, like cross-linking, for instance, you can actually halt that disease. So that is a major risk in the teenage years. That's where most of them progress.
Yes.
Yeah, I think that's probably the most important things in those hormone groups.
Perfect. Let's chat about some of the services and operations that you offer.
But before we carry on, I just thought of another one. The emotional stress that actually the teenagers go through is also quite a topic. So the eye fatigue that goes with cortisol levels is actually a whole nother group. And that can even be in adults with maybe stress hormones being just through the roof. Or even if you think of maybe the menopausal phase where you haven't checked your diabetes and your thyroid at the same time. So these type of hormones that go with not just your normal growth and sex hormones, but the other things can be things like twitching of the lids or sensitivity to light, or if you have poor sleeping habits and the effect that has. So that's just an extra. And then regarding the services that are offered, like you asked, so specifically like we mentioned, so general ophthalmology will be everything from cataracts, and we have specific specialists at our practice that look at glaucoma and retina separately. So I focus on the ocular plastics, which is all the surrounding areas of the eye, as well as the cornea or the ocular surface, the link between the two. But that is basically an all-round assessment, and the full eye health can be achieved. On that topic, now that we speak about things like surgery, and if you think of laser refractive surgery, for instance, if you are pregnant or having hormonal changes, that's kind of the time that you wouldn't want to have a procedure like that done. So always make sure you time your visits well as well. You're not going to go for a refractive surgery if the cornea is maybe a little bit swollen, and now you do a procedure that causes a permanent change to it. But also if you are in these high-risk areas or phases of your life, that's also a time to maybe have your more regular checkups. And it's probably a good rule of thumb to have that annually. If you have specific disease, it might be as often as 6 monthly. If you are very stable but maybe have a family history of something, sometimes that can go to a 2-yearly checkup. But always early detection is the things that make
that was actually our next question. It was, not to wait, and sort of what is the rule of thumb? So you say annually it would be a good idea.
That's generally quite a safe one.
A general, yeah. Okay, perfect. What are the 3 things to remember when choosing a good pair of sunglasses?
That's a good point. So you want UV filter or UV protection in your sunglasses. So the higher that can be, the better, and often they go from a 400 at least as a starting line. So you don't want to buy dark glasses that is only dark, because you will be dilating the pupils and allowing more light in. So more damaging light rays reach the retina and the lens, and that's where we don't want the damage happening, even the surface. So you can imagine if it's dark without the UV protection, you're actually damaging your eyes. So sunglasses are going to have to be a proper, not necessarily the brand, but it needs to have the proper UV certification that it says it's got this amount of UV protection. Even better if it can have side shields kind of blocking out from the sides. If you think of a common skin cancer like basal cell carcinoma, it often happens in this area where we have a lot of reflection or concentrated light rays forming. So if you can have the kind of the stray lights also limited to a degree, that can definitely be beneficial, not only to the eyes but also to the surrounding skin, which is a very sensitive skin around the eye. And then so sunglasses, I would say the UV protection and the side shields if you already have dry eyes or other things, for instance, that can be beneficial. And the third one, do you have anything else?
No, I was actually thinking, because now that it's summer, you know, you obviously want something nice, but you want something functional, because there's nothing worse than a glare. You can't enjoy yourself. Whatever you're doing, you're going to get a headache, and it's obviously damaging your eyes and all of that. So it's such a sort of important thing to know what to look for.
Absolutely. Yeah. And then the things that go with that. So if you are struggling from dry eyes, for instance, make sure you have your little bit of lubrication, especially extra. And then in summertime, where wind and just evaporates those tears that much quicker. So
yes, exactly. Okay, perfect. Are there any upcoming events or workshops or collabs that you are going to be having in December?
In December, we need a bit of rest.
Yeah.
There are a few training courses and things, but it's often, I realize now as you ask that, it's often the medical profession that we cater towards, and not so much patients. So it might be an area that we actually do need to look into, and can we offer more patient orientated workshops? So that's a good thought that you are highlighting there. We're always just catering for colleagues.
Yes. If someone's watching this and they really think, oh my gosh, I need to come see you, you're amazing, how do they get hold of you? What are your contact details, website, socials?
So my main practice is Atlantic Eye Centre, and we have a branch in Foreshore, which is that Cure Day hospital close to Christian Barnard. Or we have a Blauberg branch, which is at the Netcare, that side. And then I also do a lot of the plastic surgery at Alchemia Clinic, which is the cosmetic side. And then also in the northern suburbs at Advanced Eye Health, I do some of the plastic surgery cases at a colleague of mine. So you can basically all around Cape Town find me, and I think the easiest is probably atlanticeyecenter.co.za, the website, and our reception will be happy to direct you to the different branches.
Perfect. And your socials, are you on Facebook, Instagram, anything like that?
So Atlantic Eye is on all the social media, as well as Alchemia Clinic. Yes, not personally.
Amazing. No. That's perfect. Okay, thank you so much for joining us today. It's been really, really a lot of information that's really interesting, and just goes to show how everything is so interconnected at the end of the day. So it's really important to take care of your overall health.
Absolutely. And I think we often don't realize how intricate the eye and how far spread it actually goes. So thank you for highlighting it as well, and just bringing that awareness. I think that's important. The more we can educate and get the word out, the more, or the less reluctant people are also to come for the eye exams. I think they often fear what they are going to hear, where a lot of things you can actually
do something.
Yes, and there are
prevention and
so many advancements that a lot of it is not a dire diagnosis anymore, maybe like it used to be.
Exactly. But thank you so much for joining us.
It's such a pleasure. Thank you for having me.